Hi and welcome to my channel. Today we will be watching episode 5 of the Trauma Code, so let's jump right in. Wow, they really made a meme out of him telling them to shut it. Is she cracking up at it? Yep, she is.
어떡해. 아, 데뷔하고 싶다고 하시더니 성공하셨네.
에이씨, 와, 이거 전혀 예상을 못한 전개인데 이거.
Yeah, I guess you forgot his personality. Oh yeah, of course you guys are loving this.
표정을 내가 실시간으로 봤어야 되는데 말이야. 아유, 아주 기자들 신났네요. 어? 야심차게 꽂은 낙하산이 바닥을 보였네요.
마냥 좋기만 한 건 아닙니다.
Yeah, it's like your hospital, mate.
여기 저 혼자 자빠지는 거는 괜찮은 일인데 말이야. 아니 이번 일만 해도 그래요.
It's your hospital.
병원 격이 있지. 아니, 병원 얼굴에 똥칠을 하고 말이야. 그 와중에 외상외과 예산 올려달라고 나한테 다이렉트로 메일을 쐈습니다.
Yeah.
네. 뭐라 그랬는지 알아요? 병원 사정상 정 어려우면 장관님한테 다이렉트로 부탁을 하겠다고. 이거 다
Ooh.
매기는 거 아니냐고. 아, 그런 일이 있어.
Is it what's picture on there?
블랙 닌자. 세계 최대 민간 군사 기업. 주로 분쟁 지역에서의 VIP 신변 보호, 필없이 구출 작전 등 전투 대행까지 수행. 특수부대 이상의 전투력을 자랑한다. 고위험군인
wow.
만큼 임무 시 메딕과 동행하는 것이 필수 수칙이며 인간 병기로 알려져 있다.
Oh. Is this what you're imagining?
감정. 와,
Is he gonna look over your shoulder and be like, what are you reading?
와 장난 아니다. 궁금한 게 있는데요. 진짜 그냥 다른 의도는 없고 진짜 순수하게 궁금해서 여쭤보는 건데요.
왜 뭐?
그 국제평화의사회에서 갑자기 블랙인지로 간 그 갭이 이게 이해가 잘 안 가는데. 아, 더 위험한 곳으로 가신 거구나. 가면 중증 환자들 더 많으니까. 그래서 그런 거.
돈 벌라고?
Oh, there you go.
그냥 뭐 페이 많이 준다길래.
관광버스 2대 포함해서 대부분의 차량들은 대교 위에서 구출 작업 진행 중인데 버스 한 대 포함해서 차량 4대가 다리 아래로 추락했다고 합니다.
Wow.
지금 구급차들 도착하고 있습니다. 빨리 오세요.
주생자가 상당할 것 같습니다.
눈 감고 계세요. 눈 감고 계세요.
Wow.
네, 여보세요?
저보, 레지던트를 싹 다 수배.
응급약과 지금 인턴까지 싹 다 총동원입니다.
갖고 와는
와우.
말이야. 특히 외과 쪽은 전부.
네, 알겠습니다.
I wouldn't even know where to begin.
교수님.
Because obviously you need to find out who is in the most serious condition and work from there, aren't you?
아니, 왜 그러세요, 교수님? 환자. 안 팀장님, 백강현입니다. 들리세요? 안 팀장님, 안 들리세요?
What?
안 팀장님, 백강현입니다. 백 교수님이세요? 여기 지금 장난 아닙니다.
Wait, which doctor is this?
다리 밑으로 떨어진 차량들이 있다고 들었습니다. 그쪽 구조 시작됐나요?
Oh, okay.
아니요, 다리 아래는 시작도 못했습니다.
Wow.
지금로 접근이 어려워서 로프버스 내려버렸고.
Ooh. Yeah. No, you're going in a helicopter.
진짜 일중한 중증외상 환자들은 거기에 있어.
Exactly, because that's where the accident. Well, the vehicles fell off the bridge, so yeah, they'll be the ones that need the main focus right now.
최대 40명까지는 응급실에서 동시 진료 가능합니다. 현재 38명 진료 중이고요. 곧 초진 후 각 과와 연기할 예정입니다.
그래요. 임 과장.
You're more thinking about the money, though, ain't you?
그 중상자들 죄다 실어오면 어쩌나 싶었는데, 아니 돈을 또 얼마나 퍼부었을 거야. 전기세도 안 나오겠구만.
실장님, 그 말씀을 아니 남들이 들으면은 내가 돈 때문에 중상자들을 받기 싫어서 재난 프로토콜 발동한 줄 알겠어요. 응?
You did.
아이고 원장님 그럴 리가요. 아니
That's clearly what you did. You just didn't want my man to like vocalize it, but that's what you did.
신중하자 그거죠. 아니 그 중상자들 살린답시고 백강혁 그 자식이 얼마나 설쳐되겠어요. 예?
Dude, what do you think he's doing?
인공적이고 삐끗하면 한국대 병원에서 사망. 그런 불상사는 사전에 막자. 응? 안 그린 거죠?
예, 저 기조실장님.
Okay, and have you asked where he is now? There we go.
그러니까요.
Yeah, exactly. Uh-huh.
없다고?
He's gone to the crash site.
환자를 봐야지 어딜 가?
예, 저도 분명히 그렇게 얘기를 했거든요. 아니 근데 뭐 이 정도는 응급의학과에서 커버가 가능하다고.
아니 그래서 어딜 갔다는 거야?
예, 저 현장으로 갔습니다. 현장으로.
Yeah. Yeah. You fuckers, yeah.
중상자들을 직접 모시고 오시겠다.
Yeah. So now you're going to have more than the 38 patients that you originally thought you'd have. Okay, so they managed to get people down there finally. Ooh. Wow. Yeah, nah, man.
자, 지금부터 모든 구조자분들은 저희들을 거쳐가야 됩니다. 절대로 바로 구급차로 이송하지 마세요. 저를 기준으로 의식이 있는 분들은 제 오른쪽, 의식이 없는 분들은 제 왼쪽으로. 사망자 포함입니다. 빨리 움직입시다.
Mm-hmm. Oh. That's a serious accident though, because look how many people were affected by this. Because didn't they say it was like 60 cars or vehicles involved? Is the minister coming into the hospital, or is she just in like
장관님,
conference somewhere?
교수가 현장에서 환자들 분류하고 있답니다.
백 교수가?
Oh.
아저씨가 급하도 꼭 구해줄 테니까
That's it.
조금만 참고 있어.
Hopefully he's not one of the ones that have passed on.
교수님, 여기 좀 봐주세요.
Is this the brother?
맥박이랑 호흡은 있는데 의식 불명입니다.
Oh, he's been impaled.
출혈이 너무 심해서 일단 그 상태로 절단했습니다. 잘하셨어요. 여기 좀 봐주세요. 실가조 아파트로 이번 실문요. 네. 일단 출혈부터 잡아야지. 딱 보면 감 하나?
응.
관통상 환자 처치법 알지? 정중 절개 놓고 일단 출혈부터 잡아. 그 다음에 이거 뽑아. 예, 알겠습니다. 제가요?
Yeah.
이 환자 데리고 가서 수술방 들어가. 난 분류 끝난 대로 따라갈 테니까.
He's like in a helicopter?
분류를 제가 하면 안 될까요, 교수님?
No. You need to step up.
너 딱
You
보고
can't do this all the
죽을
time.
사람인지 살 사람인지 판단할 수 있어?
그게 아니라 저 자신 없습니다, 교수님.
내가 자신 있어.
That he believes in
널
you.
믿는 날 믿어. 나 믿지?
There you go. You now just need to believe in yourself. Come on, focus. If you focus on the patient, you're not going to think about the flight so much.
자, 조심히세요, 장비쌤. 장비쌤, 수술방 열었죠?
스탠바이 중이에요. 교수님은요?
아직 현장에 있어요. 장비쌤이랑 먼저 들어가라고. 자, 출발합시다.
Don't be nervous. You got this. Just believe in yourself. He believes it. Don't shake. That's not the right time, man. Don't do it.
널 믿는 날
Don't give in to the
나
nerves.
믿지?
I know it's a lot of pressure, but it should say something that he actually believes in you as well.
우선 정중절개 놓고 출혈부터 잡는다.
Oh,
생존자입니다. 분류해 주신 환자들은 모두 이송 시작했고요.
oh, that's
너무 심한데 가망이 있을까요?
hopefully. You got this. You got this. That's the brother, isn't it? Oh, and he even looked after his sister because she said they were holding on to each other.
교수님, 오픈 프랙처 환자 한국대병원으로 출발하겠습니다. 혹시 같이 가실 건가요?
Oh. Are you going to be able to take both in the helicopter?
이 환자도 한국대병원으로 갑니다. 세환정 모두 살려야죠.
Okay. I'm not doubting his skills. I'm hoping he can do all of this.
에이 참 이거 아깝게 이거 안 먹으면 어떡해. 뼈부터 해야지. 기다려봐.
He said you're a doctor.
생명의원님 백강혁 교수님 아니신가? 어?
오픈 프랙처 환자야. 도와줄 사람 있어요?
도와줄 사람?
Yeah, you better help. He
도와줄
helps.
사람이 누가 있나 지금?
정형외과 교수님 섭외 가능한가?
수술 중일걸? 레지던트.
아니, 레지던트는 안 돼.
레지던트 같으면 누굴 섭외해야 되나?
You idiot.
글쎄.
진짜 너무 심각해서 그래. 부탁 좀 합시다.
아이 알았어. 에, 백 교수.
Dude, do it.
아이, 진짜 이.
Yes.
먼저 끊고 있어.
Yes. Your daughter's going to be like, go on, Dad.
오빠.
응?
왜?
아니 아니 손모 자른다고 수술방 들어오라는데 내가 껴도 되나 몰라?
나는 완전 찬성.
They see?
내가 왜 의대 갔는데? 우리 아빠 메스 잡은 모습 너무 멋있어서.
See, look, daughter's popping you up. Go on, go. Yeah, make your daughter proud.
끝났어?
안 한다고.
아이 그러지 말고 좀 어?
나 오늘 한 끼도 못 먹고 벌써 오늘 수술 몇 번이나 한 줄 알아요?
아이고 참 아니 알지 그러지 말고 어? 아니 환자는 살려야 될 거 아니야 환자
예, 마칠 겁니다.
Yes, you need to go to surgery now. This guy. What is what? These people in this hospital are bloody annoying. They are going ultra lazy.
아, 예, 그 박경원 선생이 몇 번 방이냐고 묻네요. 아, 예, 알겠습니다. 응급수술실.
Alright, he's going.
야, 박경. 짜증나지도 않냐?
For
나
what?
스케줄 다 밀렸는데 응급 갑자기 쳐놓고.
말 그대로 응급이니까 갑자기 쳐넣을 수밖에요.
Exactly. There's no plan for an emergency. It just happens.
대비해서 마취과 인원은 어느 정도 대기하게 되어 있지 않습니까? 그런데도 전부 예약으로만 돌리고 있고요. 잘못됐다면 그게 잘못된 거겠죠.
Thank you, my guy. Tell him how it is. Speak the truth.
가지 마.
Why?
왜 그러시는 건지.
외상센터 마취과 전의미 모집 공고. 2년째 지원 없는 거 알지? 그 사람들 희망 고문하지 마.
Hold on. So you want the patients to die because you don't want to give them false hope for having a full-time anesthesiologist? The people's priorities in this hospital is not that great at all. They really are thinking money first, patients later.
과장님, 여기 하복부 좀 맡아줘요.
나보고 이 수술을 하라고 지금?
아니,
예?
한국과에서 직장 수술 많이 하잖아요.
이거 난이도가 이것 좀 있는데.
Oh my gosh, my guy.
마취과 왜 안 와?
마취는 폭포로 시작하겠습니다.
빨리.
Oh, thank you. He came. And I don't think it's just because they asked him to spy on him either. I think he generally is more about helping people.
내가 지금 출혈 부위를 검지, 중지, 그리고 손바닥 아랫부분으로 막고 있거든요.
이렇게.
한편 관광버스가 다리 아래로 떨어지는 대형 사고임에도 사망자가 적었던 건 현장에 의료진이 빨리 투입돼 현장의 골든 타임을
But that's what you want.
때문이었다고 파악하고 있습니다.
보건복지부 강명희 장관은 각 병원으로 이송된 환자들의 치료에 최선을 다해달라고 당부했습니다.
네, 저는 지금 한국대 병원 앞에 나와 있습니다. 이곳에선 부상이 특히 심한 중증외상 환자 3명이 응급수술 중입니다.
출혈 잡히면 여기 상부부 비장부터 바로 시작합니다. 아니 손이 왜 이렇게 느려? 좀 빨리.
Oh my gosh. I know he's. I think you're probably thinking number one's doing quicker. But you need to speed up it.
그래도 좀만 더.
왜 이렇게 서둘러?
This is for patience.
출혈 잡았고 파이프 제거하겠습니다.
Okay. Still going. Doing okay. That pipe was in deep.
뭐야 이거 어떻게 된 거야? 부신 쪽에 뭐 좀 문제 있는 거야?
이 환자 캔서인 것 같아. 림파티스가 새고 있어.
어? 림파?
Oh.
야야야 나 난리 났어 난리 났어. 너 어떻게 좀 빨리 해봐 지금.
호세 맥제.
ABP 190, 200.
야
오.
하라고 야 지금 하부부 쪽에 출혈 장난 아니야 지금 엄청나. 야 이거.
Alright. Stop panicking. Stop panicking.
아리스 미아로 갑니다. 심실빈데.
He really like gives you anxiety when he's in the room because he just like his panicking just makes it worse.
이제 마무리합시다. 그래. 얼른 봉합하자고. 아니,
No.
과장님이 혼자 마무리하시라고. 난 이로한테 가봐야 되니까.
무슨 소리야 이거 지금 나보고 혼자 하라고?
일단
예.
탄력 주고 안정됐고 나머지는 박 선생한테 돈 받아요. 이 환자 반은 제가 살린 거야.
Yep. See, he gives props where props are due, innit?
이거 정말 간다고?
And he's believing in you. So come on now, don't mess it up.
근데 수술실가 커내가고 있어.
최선을 다하고 있긴 한데요.
피 나온다 피. 거주 주세요.
혈액세트 교체할게요.
석션 파워 좀 올려주세요.
He can hear all of that.
야.
Run.
피가 뭐 어쨌다고?
야.
교수님, 그 손 치워봐. 화면 안 보여. 쳐봐, 저거 아직도 장갑막에서 헤매고 있네.
아 그게 이게 반으로 잘려 있어서.
He don't want to hear
싹다
excuses.
지지고 들어가면 되잖아.
He didn't think that far, did he?
타일을 저렇게 하니까 피가 터지지. 지방하고 동맥하고 완전히 분리시켜야지.
아까 너무 급해서.
구두블로 뛰어 빨리.
네, 알겠습니다.
Oh, was this the woman that's got diabetes?
이로 아까 네가 손댔던 데 싹 다시 묶고 안쪽까지 잘 살펴봐. 어? 괜찮다 싶으면은 나머지 출혈 부위 지지고 닦고. 알았어? 예?
교수님 어디 가세요?
To the other side. My man really is busy. He ain't stopped. He's just jumping from surgery to surgery.
출혈도 진작 잡았는데 뭐가 문제야? 어?
You missed something, haven't you? I'm sure that's what it is. There's something that's been missed. Oh, now.
삭전증이 일어나는 거잖아.
See, that's what I'm saying. You missed something.
헤파린 주입 완료했습니다.
세츄레이션 올라갑니다.
고빈 넘겼고 왼쪽 다리 내가 맡을게요. 테레 다시 해주세요.
이거 오픈 프랙처라 아무나 수술 못해요.
He's not just anyone, my guy.
그러니까요.
Let him show you. He's gonna school you today. Oh, wow. Okay, I didn't expect. Yeah. All these people that keep on thinking he can't do something, and then he shows them that he actually can.
대형 참사임에도 사망자 숫자 비교적 적었던 이유는 현장에 직접 출동한 백강혁 교수의
현재 한국대학병원으로 이송된 3명의 중증 환자들은 응급수술 중에 있고 상황을 지켜보고 있다고 전했습니다.
Yeah.
보건복지부 강명희 장관은 각
Oh gosh, you running to go meet the minister?
아 이거 또 숨을
No. Oh, what is their problem?
저기 응급센터 밖에.
소월대기요. 그 중상자들 수술방 상황은 어때?
그건 저도 정확히.
What do you mean you're not entirely sure? What are you doing?
응급의학과 과장이 응급실 환자를 모르면 누가 알아?
How are they his responsibility?
중상자는 백 교수 담당이라 저희 쪽에서 보조 인력만 지원하고 있고요.
어?
응? My man's walking with that confidence. Yeah, look, even his number one. Yeah, they've done it right. They've done their two.
들어온 지 이제 겨우 3시간인데
Yeah, and?
수술방에서 벌써 나와?
Yeah, and? No, you're gonna think they passed. Really? Can you not verify these details before you jump to conclusions? Like, talk to that man first, you know. You think he's gonna be bopping out there looking confident if they all died? Oh, yeah, now you can't say no. Don't want to embarrass yourself or the hospital. Oh, yeah. I told you to get out of the way. Hey.
뭐야 이것들은? 기자들이 백 교수 수술 끝나기만 기다리고 있더라고요.
왜?
서울대교 중상자.
Oh gosh, don't you dare.
사람들 앞에서 사망 발표.
No, because you didn't even verify. You're just jumping to conclusions because his surgery time is so short.
자, 여러분 주목해 주십시오. 오늘 외상센터로 이송되어 온 환자분 셋 모두 살았습니다.
Yeah, because you took the lead on one of them. Oh, see? And you was at the scene as well, so you did help. Innit? Have confidence, man. The nervous smile. I'm sure your peoples are proud of you. Yeah, you ain't gonna be doing them memes and making a joke out of him now, eh? Well, you probably still will, but it's not gonna be as bad. Oh, there we What's this over dramatization of what didn't happen? Oh gosh. Oh, you're gonna name the other doctors, aren't you? Ah, see? See, look, he asked you for help and he pays you back your dues, man. Yep. Yep.
한국대병원에서는 이번 성취에 만족하지 않고 더욱 노력하여 국민 여러분의 기대에 부응하는 중증 외상센터가 되도록 그 시작의 첫걸음으로 외상외과 전임이
Oh no, here we go for the budget increase. My man knows what he's doing.
약속드립니다.
Yeah. Smile. Of course. And then if you don't do it, it's not his fault, it's the hospital's fault.
이졸장님.
Yeah, you should have gone back indoors. Because now he's just put your face on it.
부족한 예산에도 최선을 다하고 있으니 더욱 잘 돌아갈 수 있게
Oh.
인력 충원을 건의드리는 바입니다.
Well, like, oh, I'm not here, I'm not part of this. Yeah, you fricker, you ran out there to try and say something, and now look what position you got put in.
그렇죠.
Yeah, he got you. Yeah. And the thing is, if it doesn't get done, it's not his fault because he has no control over the budget. It's your fault. Oh, here we go. Ah, got you. This guy's a joker. Oh, this guy is funny. He really knows how to use a situation and to his best advantage, I guess. Because, like, the fact that, yes, there was this incident that's happened, they've made sure to respond quickly. They've got all of the patients to, hospitals that can care for them. They've had 3 in critical condition that he's managed to save in 3 hours. And yes, he's had help from other departments. He made sure to, make sure that everybody is aware of who helped him to make this possible. And then he goes on to be like, and because, obviously we need extra space. We want to expand, but we need the budget to do so. And we got one person in charge here. Thank you, guy. And director, I know you're watching. Yeah, dude, dude, use the press to help him get a budget increase, which they didn't want to give him. And the thing is, if they now don't give it to him, especially with the minister calling, knowing full well that she gave them what 10 billion won for the budget for trauma, and if she's asking about where this money's gone as well and wants proof of that, it's not going to look good on the guys in charge, because she brought this guy there for a reason, in order to save and expand the trauma center, because she was tired of having hospitals keep turning away patients and then dying on the way to the next hospital. So she wanted this to be the trauma hub, and they're playing with that vision. She ain't gonna be happy. She gonna want answers. And these buggers that are all about money, they're gonna have some explaining to do to the minister. So yeah, like, you helped out Urim's daughter in the first episode, or he helped out Urim's daughter in the first episode, or the previous episode, I should say. And now you've come to, I guess, collect back on that favor. I know he asked him to put in a good word with him in regards to the budget, but at the end of the day, he ended up having to call in a favor and ask the guy to like come and help out in the surgery. And yes, okay, he really was rusty. He was very panicky. To be fair, how has he got so big headed and he's shown all these awards and all that stuff for him being the, what's it, the correctoral doctor? Do they not work in surgery at all? Because, like he says, you had to have done some form of surgery. I know that's his speciality, but the way he was going on was like he has not done any type of surgery in the longest time, in that he's so rusty that he can't remember anything. And you could see that with how panicky he was in the surgery. He was worse, I think, than when number one was in his first surgery with our guy. Like, yes, he questioned a few things and like he had his little panicky moments, but I think this guy was 10 times worse, because it was like known us from start to finish. The other guy, once you tell him, like, yes, he'll calm down, he'll listen. You can see like he kind of analyzes the situation a bit. He's trying to learn how to be like the doctor. But this other dude was just panicky, panicky, panicky. And it's, yeah, you wouldn't want someone like him in your surgery, especially if you're in a critical condition, because you would think he's going to mess up, because like his nerves would get the better of him. But thankfully, he's managed to pull through. He was surprised at how quick like our guy like done his part of the surgery. I think he was also shocked at the fact that he's basically telling him like, yeah, you're gonna have to do the rest of it from here. I need to check on number one. He goes to see number one. Yes, he does mention about how he did proceed with the surgery. He wasn't quite happy with his methods, but again, it's become like a learning experience. He's basically told him like, look, this is what you need to do. Make sure these things are in place. If you started to sew him up and the bleeding's not too bad, you can cauterize the rest and you can go from there. And he trusted him enough again to leave him there and go and help out with the third patient, which was also in a bit of a touch and go situation. So yes, he believes in the doctors. Sometimes he may have to tell them how to do things, because obviously they think he doesn't have experience, when really, again, as I mentioned, I think while I was watching it, as a trauma surgeon, you don't focus on one speciality when it comes to surgery. You kind of need to have knowledge of it all in a way. Like, yes, you would probably need to call on other departments for assistance, but if you can't get them there in time because they may have like a full schedule, they're currently in surgery and they can't leave, then yeah, you need to work it out. So he's basically, in a way, showing that as a trauma doctor, you need to have knowledge on a lot more than, just one field that would be expected for it. Because, like they say, trauma can happen at any time, it could be anything. And you need to get to work on them quicker. They can't exactly just, wait for the OR to be available for someone to perform the surgery on them, because it's trauma and it's critical. It needs to be dealt with as soon as possible. But yeah, they it's a good show. He's been putting quite a few people in their place, even on purpose, or just him just being himself. Like, he definitely has confidence in his abilities and he ain't afraid to show it at all. But yeah, we will jump on to the next one. Hope you guys tune in with that one as well. Don't forget to like, comment, and subscribe. And bye.